when you have a patient walk into the room, they give you their history and they're telling you their symptoms, and you're observing their signs. Observation is a huge part of Chinese medicine. What you do then as an acupuncturist is you translate their signs and symptoms into a Chinese medicine diagnosis. And what makes TCM very unique is that two people can walk in with the same Western medical diagnosis. So if we take endometriosis, for example, but they can have two very different Chinese medicine diagnoses. The reason being is that because they are two different people. What Chinese medicine takes into account is your diet, your lifestyle, your upbringing, your childhood illnesses, your work, your emotional environment. Whereas obviously in Western medicine, you either fulfill the criteria for a diagnosis or you don't. One of the other really interesting concepts with Chinese medicine is how it views health is it's like a tree. So there are roots and branches. So the branches are the signs and symptoms that a patient might be aware of on the outside. And then the roots are the kind of deep constitutional imbalances a person might have in their body that have allowed those branches to grow and to flourish. So when I formulate my point prescription, I'm thinking about the branches. How can I help that person in the here and now? But actually what my main focus on is their roots.
Welcome to the 51%, the podcast where we cut through the noise and get back to basics when it comes to women's health. Through expert insights and powerful personal stories, we help you tune into what really matters: your body, your well-being, your life. No one-size-fits-all advice, just real conversations to help you understand your health on your terms. But before we dive in, I've got a quick favor to ask. Please hit subscribe and join the 51% community on our website. It's free and helps us grow, reach more women, and create events that really speak to the health and wealth challenges we all face. And finally, just so you know, everything shared is for information only. It's not medical or financial advice, and always speak to a qualified expert for support that's right for you. Sunila, thank you so much for being on the podcast. It's great to have you on. I'm really excited to have this conversation because you're a doctor, you trained to be a doctor, and you have kind of switched profession, which is amazing. And also you have almost like the best of both worlds and the knowledge of both worlds, which is great. So could you introduce yourself and talk a little bit about your journey from, training to be a doctor and why you changed to become an acupuncturist and do what you're doing now? Thank you so much.
Yeah. Oh, no, thank you so much for that lovely introduction, for having me on as well, Shreya. I think it's probably one of my number one FAQ is how did I end up here, basically doing what I'm doing now, having started off in a very conventional, traditional career like medicine. And I guess the easiest way to kind of explain how I got here is kind of starting at the beginning, really, and explaining kind of my upbringing and how I got into medicine in the first place too. So I'm South Indian by background, and my parents are from Kerala, my family's from Kerala, and I grew up being exposed to Ayurvedic medicine. So it's a style of medicine that's originated from Kerala, from South India. So I guess the easiest way to kind of explain how I got here, and because it's a really commonly asked question that I have, is how did I end up here from being a doctor to an acupuncturist, is to kind of start at the beginning a little bit in terms of my upbringing and how I got into medicine too. So my family is South Indian by background. We're from Kerala, which is the home of Ayurvedic medicine. And I grew up with kind of the childhood remedies, home remedies and things like that. If I had a rash, then my dad would whip out this like Ayurvedic cream that had very few ingredients listed on the back of it, and he didn't really know what was in it. Yeah. You put that on and it would clear up. But, if I needed antibiotics or something, they'd take me to the doctors for it. So I had a very, I think, open view of what medicine meant, both conventionally and kind of traditionally as well, and that real tolerance for just appreciating different views of health, especially living in a town like Croydon, which is really diverse and mixed. I feel very lucky that I've grown up in a town like Croydon, because you just meet people from different walks of life, and then naturally you kind of absorb people's different health beliefs from that as well. So I always had that openness there. And I guess when it came to choosing what I was going to do for uni, I was heavily encouraged to pick a professional qualification. I wasn't forced to do medicine, unlike maybe a stereotypical view maybe people have of child immigrants. That wasn't the case. But in terms of the professional qualifications that were open to me, medicine seemed like the best fit. I volunteered as a St. John Ambulance first aid cadet when I was growing up. So it just felt like all my skills, my kind of attributes were best suited to that. So I got into medical school, and I did find it quite difficult in medical school. I put a lot of pressure on myself. I worked really hard, and I did well in my exams, but I did go through bouts of kind of anxiety and depression with my mental health, but I got through it and did well, and then got into work. And then I think within the first year of working, it started to kind of click that maybe, even though I could do the job, it maybe wasn't meant for me. And by that I mean, when you start a shift, you do a ward round and you generate a list of jobs. I would get those jobs done. I was a hard worker. But that element of caring for people for me was just missing. I wanted to spend that extra 5 minutes with that patient and talk to them and provide that element of care. And for me personally, I wasn't able to fit that in and still get the essential jobs done. I felt like I was fighting fires. And so that was when the wheels started turning for me about what I could do in the long term that could fulfill that need for me. I didn't think at that point that I would leave medicine completely. I was kind of thinking that I can do this for a while, but I need something else that will help sustain me. But I carried on and eventually found a job in paediatric medicine. And at that point, I felt like I had somewhat found my home in Western medicine, and it was incredibly fulfilling. But as you can imagine, with the kind of ups, there were downs as well. And I struggled personally with the kind of more emotional aspects of the job, the losses, as well as the job itself in terms of it was quite an on-call heavy kind of job. So 13-hour shifts, night shifts. And I wasn't able to switch off before or after a shift. The adrenaline stayed in my body for a long, long time. Even when I'd go on holiday or go on a break, I could still feel that in me. So I guess my thought process wasn't that complicated really when I thought about what else I could potentially do. I wanted to do something where I could still diagnose, I could still work with people, I could still use my hands and be practical. I wasn't necessarily behind a computer all day long. And so I thought, well, another kind of medical paradigm is the way forward. And having grown up with Ayurvedic medicine, I thought, well, should I do that? And I thought, well, I kind of already know a bit about it. I've got some sort of ancestral knowledge there existing. Maybe it's worth me looking into something else. And growing up, my mum had acupuncture done herself. She'd had the kind of Chinese herbal remedies. I'd had acupuncture myself when I was at uni. So I thought, let me look into this a bit more. And when I looked into it more on the courses that were available, it's a 3-year degree level diploma that I ended up doing. So it's a very intense kind of heavy duty course. I thought it's got a bit of everything and what I want in terms of having that practical skill, but having that depth of knowledge as well. And for me, what was really important in picking a course was being able to learn and understand Chinese medicine theory, to be able to translate someone's symptoms into another medical paradigm and do something different with it in terms of prescribing a treatment with acupuncture. I was doing my paediatric job part-time. I was doing my acupuncture diploma. I was also studying for my postgraduate paediatric diploma at the same time, and managed to do all of that. And I got to the end of my acupuncture course, and I took a year out of training from my paediatric course to set the business up. And it got to the end of that year, and it just dawned on me that I couldn't go back to paediatric training. I'd had enough distance, I think, both physically and mentally, to realise maybe the pressure I had been putting myself under and the detriment it was doing to my mental health, my physical health as well. And And it's still very much a transition in my mind. Like for me, I'm still a doctor, even though I'm not working in a typical NHS setting. Fear I had was that is this going to all go to waste, all that hard work? Because it starts before you're 18, getting into medical school, getting
Yeah.
through it, and then afterwards. But actually, I think what I'm coming to appreciate, and at least what my patients tell me, is that medical background is worth so much to them. Because naturally, although I'm not practicing Western medicine in my clinic, they get the benefit of having kind of my Western knowledge there, but having it match and walk hand in hand really with my Chinese medicine knowledge. And so that's how I've got here. A very long answer, but that's how I got here.
Yeah. I mean, it must have been quite difficult, really. You went to one of the world's best universities, Imperial, and I mean, getting into Imperial is a massive, massive, fate. It's just amazing. It amazes me when people get into these universities, and in doing medicine, it's just, it's a big achievement. What you've achieved is absolutely amazing. Let's not even downplay that, okay?
Oh, thank you.
And it's almost, you've made this shift into this kind of new area, the Eastern medicine, and it's almost like, well, you have to be quite mentally resilient to do that. You're challenging
a little
what
bit crazy.
Yeah, or a bit crazy. Yeah, you've got the challenges with societal expectations, right? That's one thing, and then cultural expectations. Immigrant family coming over, expectations on, and then obviously you going to do what you did. And then just deciding actually something is not feeling right with me. Whatever that is, you actually moved with your feelings, which is amazing, and didn't get stuck in that whole, I went to the best university, I've done medicine now, and this is my life. It has to be my life. And it's that you actually had a big mindset shift. And I just want to delve into that a little bit, because how did you overcome that? Because that's quite a big thing to me, especially coming from like a South Asian community. It's quite a big jump.
So I mean, I guess it's a couple of things really. Number one, I think the first and foremost is I have to say my circumstances allowed me to make this shift. So I was very fortunate in the fact that as soon as I finished uni, I got my job back home in Croydon, and so I moved back home. I was able to save money, and then as soon as I got married, my husband and I lived with my parents. So we paid them some rent, but a small amount, and so I was able to self-fund my course. So from a very practical point of view, I had that financial safety net, that life safety net there. On top of that, I had the kind of support from my husband as well. He's in medicine. He's going to be a consultant next year. He made it to the end. He committed. He's going to be a consultant psychiatrist next year. I'm very proud of him. And so I had his backing as well. And you mentioned the cultural kind of expectation, the immigrant parent expectation. And, with my parents, love me to my core, would do absolutely anything for me, as most parents would, and particularly immigrant parents, go to the ends of the earth for you. And I think for me, for them, it wasn't necessarily about you have to be a doctor purely because of the status, or anything like that. What they could see in me is, and what I saw in my pediatric job, is parents know their children, right? They know their soul. And they could see I had all the attributes in me to be a great doctor, and particularly to work with children. And I remember now, mentioned this to you before, I think it was when I was doing my pediatric job. Within my first year, I had a particularly bad shift. It was an A&E when I was locuming, and we'd had what we call a red call in a shift. So it's basically where a child comes in non-responsive without their heart beating, and we had to try and resuscitate them, and sadly we couldn't get them back. And that child was about 7 or 8 years old, a boy, and my nephew at the time was around that age. And I just came back home, and my mum found me in the kitchen, just leant over the kitchen counter, and I saw her, and I just started crying. I couldn't hold it in, and I said, I'm not sure how long I can do this, Mummy. I'm not sure. And she said, Sunila, you're meant to look after children. you're meant to look after children. And she wasn't wrong. You know, I do have that kind of affinity with kids, and there's something different when a child walks into my acupuncture clinic now. There's a different like gear that kicks in for me. But for me, and so I did say, you know, look, I'm going to try training. I'm going to give it my all, but that's all I can do. But what you then appreciate, particularly with a job like pediatrics, is that life is short. There's this very stark reminder there that it's cruelly short sometimes. And what did my parents work so hard for to take? They weren't able to take risks. And something my dad said to me, actually, I think that stuck with me, and that was the final motivator for me to keep going and to actually make that transition was, he said to me, Sunila, I didn't take risks so that you could. And that for me was enough. And I do know that, you know, when I was starting my course with acupuncture, they didn't really know what I was doing. They were like, you're doing this course, but you're also still working, like, okay, whatever, like, do what you used to do. But then I think when they finally realised that I wasn't going back, I did speak with both of them sort of separately. And I think it dawned on them that my happiness and health were kind of paramount, obviously, and that it wasn't going to be sustainable with that career in pediatrics. And what else does a parent want other than for their child to be happy and healthy? So they did. My mum did say, you know, I think it's a shame that you won't be a consultant. I said, I understand that. Like it's not just my achievement; it's her achievement too. But I think what I told her was that I'm still making a difference with my patients. It's just in a different way. And it's in a way that is good for me too. And like I said before, it was something that I could do, but maybe not necessarily something I was meant to do. And actually, to be honest, if I look back now at 18 years old, if I'd written my skills down on paper, what my strengths were, but also what my weaknesses were, then maybe that would have been a bit more obvious. But you only know what you know at the time, right? And actually, maybe I should have gone into like early years education or something. And you know, there's still time for that. I've learnt now you can pivot careers and go for it. So hey, that's maybe what my 40s are for. But I realised, you know, that I was very fortunate. It's a combination of me being very fortunate in my circumstances, but also being given that kind of implicit permission from my family, from my husband as well, to be like, you know what? Go for it, like take that risk. And I'm just very, very blessed and fortunate that I was able to do that and see it through, actually.
Yeah. And there's something in that as well, because it's almost like saying, you know, you had the right kinds of people around you to give you that confidence, to give you the, you know, strength and the ability to say, you know, Sunila, you can do this. Just do it. Follow your dream. Follow what you want to do, what sits right with you. Because equally, you have a lot of negativity and people, whether they're friends or family, it could be anyone, saying negative stuff and potentially just put you off the whole thing. And then you don't end up following what you truly want to follow. You know, and the other thing, you know, there is a lot of status and emphasis put on Western medicine. And people often forget the kind of Eastern medicine. And correct me if I'm wrong, a lot of the Western medicine stems from the Eastern medicine.
I mean, a lot of the inherently,
exactly. So can you? Go ahead.
Oh no, I was going to say there's a lot of like people think maybe that Western medicine and Eastern medicine are at odds with each other, but actually there's a lot of synergy. I feel on a fundamental level, and you know, there's an interesting concept in Chinese medicine of yin and yang. Are you familiar with it? You know, so
I've heard of that.
If your listeners who aren't aware, so if you imagine there's a circle in front of you and there's two teardrop shapes that they fit in and interlock with each other, and one's white and one's black, but they both have a dot of black. The black has a dot of white in it and the white has a dot of black in it. And that's how I see Western medicine and the Eastern paradigms of medicine. And actually in my first year of my course, we had to do a little presentation on yin and yang and what it meant to us. And that's the analogy I used, because essentially they're what yin and yang is in Chinese medicine. They're two opposing forces that work together to balance each other out and bring harmony in the body. And that for me is like the perfect embodiment of what Western medicine and Eastern medicine is. And what I feel in general healthcare can be for people is when you appreciate different perspectives of health, is that yes, they maybe come from different origins or different perspectives, but what can be achieved when you put them together and when you truly think about it in a complementary manner, not just black or white, but that dot of each in between. You know, the benefits it can bring to your health are endless, really. And I think now we're in a position in the UK, at least with where our healthcare is heading, where people are starting to realise more now that whilst Western medicine fundamentally has its place, obviously, it's life-saving, it's essential, there is a place for other approaches to health. And I guess the next challenge is about accessibility to those kind of systems. But I think at least an awareness now is coming through that it doesn't have to be one or the other. And I guess now I'm a walking embodiment of that. Like, it doesn't have to be one or the other. You can take the best of both and be safe with it too, and optimize your health on so many different levels.
And that's what makes you very unique. Typically when you meet someone that is kind of doing something along the lines of Eastern medicine, that's what they're trained in. But you have the best of both worlds, which makes you quite unique, really. Can you talk about the traditional Chinese medicine, and also what does that involve? Because I know you're an acupuncturist, but are there other things that involves, and what do you do exactly? And another question, sorry, just on acupuncture, what is that?
Yeah. So traditional Chinese medicine, it's a whole medical system within itself. It's a complete medical system, i.e. it has a form of diagnosis and a form of treatment. So it's, in China, where it originated from, it's a very kind of normal way to access healthcare. In Chinese hospitals, acupuncture and Western medical wards exist side by side. So it's a complete medical system. And it's a paradigm of medicine that has existed for well over 2,000 years. And there are different, depending on what text you read, it can stem from even longer than that, but it's based on a few kind of seminal texts, and over time it has evolved and developed. There are different kind of variations of acupuncture. So there is traditional Chinese medicine acupuncture. There is a section called 5 elements acupuncture, where it's a bit more kind of looking at a person's constitution. There's Japanese acupuncture, Korean acupuncture. So there are kind of different modalities. I guess the most modern evolution of it is Western medical acupuncture, where essentially it's acupuncture but taught without the Chinese medicine theory. So it's more protocol of points that you're taught. I chose to opt to learn Chinese medicine acupuncture because I wanted to diagnose in Chinese medicine. But it's a very rich kind of tapestry. And so essentially what you have is when you have a patient walk into the room, they give you their history and they're telling you their symptoms, and you're observing their signs. Observation is a huge part of Chinese medicine. And what you do then as an acupuncturist is you translate their signs and symptoms into a Chinese medicine diagnosis. And what makes TCM very unique is that two people can walk in with the same Western medical diagnosis. So if we take endometriosis, for example, but they can have two very different Chinese medicine diagnoses. The reason being is that because they are two different people. What Chinese medicine takes into account is your diet, your lifestyle, your upbringing, your childhood illnesses, your work, your emotional environment. So everything you're taking in externally from diet, lifestyle, even your climate, the emotions that you're experiencing in the day, all informs your diagnosis. Whereas obviously in Western medicine, you either fulfill the criteria for a diagnosis or you don't. And so for me, that's one of the unique beauties of Chinese medicine, is how individualized it can be. And then from that kind of moment of where you formulate your diagnosis, you then, what I do is I formulate what I call my point prescription. So one of the other really interesting concepts with Chinese medicine, how it views health, is it's like a tree. So there are roots and branches. So the branches are the signs and symptoms that a patient might be aware of on the outside, and then the roots are the kind of deep constitutional imbalances a person might have in their body that have allowed those branches to grow and to flourish. So when I formulate my point prescription, I'm thinking about the branches. How can I help that person in the here and now? But actually, what my main focus on is their roots. What points can I use that will address those roots and ultimately help this person for the long term? So it's not a quick fix. It's not a magic bullet. And this is the kind of thing I have to manage patients' expectations of when they come and see me initially, is that they may think that all it will take is one session and it will be whatever they've come in will be quote unquote fixed. And sometimes you can get like really good results really quickly, but actually more often than not, you need to work with that person for a period of time. But also, and this again speaks to the holistic nature of Chinese medicine, address those factors outside the treatment room. So when I speak to my patients, I say, look, your recovery is going to be like a pie chart, and let's split it into thirds. So a third of it is body work, so any energy work or treatments that you're doing like acupuncture. A third of it is diet, and a third of it is lifestyle. And so I could give them like a world-class acupuncture treatment, but actually if that person is not doing the dietary bits at home or the lifestyle bits at home, or at least attempting to address those bits with my guidance, then there's a limit to how much I can really help them. And the goal is with acupuncture is to not keep a patient on your books forever, right? You want to get them better and get them to the point where they no longer maybe necessarily need your treatment, but or they may just come back for maintenance, for example, for prevention, but they ultimately find a way to support themselves and empower themselves in their health. And so ultimately, that's what the goal of traditional Chinese medicine as a system is. And acupuncture is just one of the few treatment modalities that can be used to achieve that. There are, before I explain how acupuncture works, there are a few other kind of bits involved with Chinese medicine in terms of treatment. So other things I use in my clinic, for example, one of those things is cupping, which some people might be familiar with if they're listening at home. If you've seen the swimmers at the Olympics and they've got those big bruises, circular bruises on their back, they've had cupping done, which is essentially a way of kind of releasing kind of what we call stagnation in the body, stuck energy in the body. And another similar principle that's used is gua sha. So from a Western perspective, some people may be more familiar with it in the aesthetic kind of world where people use it for toning, but actually it's a Chinese medicine modality, and that reference is often missed a lot when people use it in a Western context. But it's originated from Chinese medicine, and in a body form you use it as a scraping method to move stagnation in the body as well. A really nice treatment to complement acupuncture. And then there are a couple of other kind of modalities that I use called, and one of them is electroacupuncture, where we attach electrical leads to needles and they vibrate the needles. That's really cool. More of a Western evolution. Yeah, acupuncture is more than acupuncture, basically. But to answer the second bit of your question, which was how does it actually work? Like, what does acupuncture actually do? One analogy that I use for my patients that is quite helpful is if you imagine, the tube map, and we've got lots of tube lines, tube networks on the tube, with the tube stations. Our body has these channels. They're called meridians in Chinese medicine, and that's where energy flows. And all these channels or these tube lines are interconnected. And the stations are essentially equivalent to the acupuncture points. And when I insert a needle into an acupuncture point, I'm telling the trainer at that station to either go a different way or to do more of something or less of something. Fundamentally, what we're telling the body is, can we bring about some balance? And acupuncture is one of the ways that we can do that, basically. From a Chinese medicine perspective, you're looking to bring about whatever imbalances you're picking up on the body, you're trying to bring about that natural balance. You're not trying to artificially work against the body. So, for example, there are some patients who say, my periods are irregular and I need regular periods again. And certainly from a Chinese medicine perspective, regular periods are seen as the balance. And so we're not trying to artificially do something the body's not wanting to do. We're trying to just encourage it back to a natural state of being. But that's essentially how it works from a Chinese medicine perspective. from a Western medical perspective, and I always make sure to explain this to patients as well, like both perspectives, because sometimes it's just a little bit easier to hang your hat on from when you see it from a more tangible point of view. Fundamentally, it's about influencing local blood flow and influencing nerve activity as well. So when a needle enters the body, and when I say needle, by the way, to clarify, it's a very, very thin needle. The widest one I use is about 0.25 millimeters, nothing like a blood test, so thin that they can bend. When a needle enters the body, it sends basically like a cascade of like biochemical reactions that send messages to your spinal cord, to your brain, that then release messages back to your body. And so that's it's kind of simplified explanation, but that's fundamentally how it works from both perspectives.
Wow, that is an absolutely amazing explanation, because, you know, my view is, and I didn't know, you know, you explain it in the kind of TCM, you call it, traditional Chinese medicine way, because from me, when I look up an acupuncturist or something, it's just, right, I have this problem and I'm going to have some needles stuck in me to release something, and then try and get that sorted out. But I love the way it's a whole holistic view. It's not just, you know, you've got this localized, let's take pain, for example. Let's take me, you know, I had pain on my neck. I had some needles put in and to try and release the pain. And that's my view on it. That's all I knew about it. So I want to ask, before I kind of unpack the kind of things that acupuncture can do for women's health, I just want to clarify, you know, whether you are able to answer this question. What's the difference between acupuncture and dry needling? Because I hear dry needling and I think, aren't they look the same to me. What is the difference?
Yeah, very common question again as well, because I do have patients who come into clinic and say, I've had acupuncture before, and before they go further, I say, was it Chinese medicine acupuncture, or was it a form of another form of acupuncture? And then they'll clarify. So with dry needling, essentially what it is, it's a Western evolution of acupuncture, most typically performed by physiotherapists or osteopaths, essentially where they're working on a musculoskeletal basis. So they're working with anatomy and trigger points. And that's not to say it's any worse or any lower than TCM. It's just a different approach from a Western perspective. What I will say, though, is typically for dry needling, the courses are a lot shorter, and there are some courses, they can be as short as a weekend course for some people. Whereas for TCM, if it's an accredited course in the UK, it's either a BSc or a degree level diploma, and it's 3 years, and you have to learn the Chinese medicine theory. So dry needling essentially is needling acupuncture for musculoskeletal problems without any Chinese medicine theory and targeted purely on anatomy and trigger points. TCM acupuncture is performed by an acupuncturist who's done at least a 3-year degree level course, and is based on Chinese medicine theory. And so they would have come up with a Chinese medicine diagnosis and then formulated their points from there. They may also use kind of Western evidence base to help them. So certainly from my perspective, I'm proficient in kind of reading papers and kind of understanding and synthesizing evidence-based research when it comes to acupuncture. So I start off with my TCM diagnosis. That's my fundamental foundation to choose my points. But if a case comes along where it's a little bit complex, or maybe there's something new coming up that I've heard of, I'll do a search on PubMed or Google Scholar, see what papers are around and see what points might be used in that situation too. So I have a somewhat integrated approach, but with dry needling, that's a very clear distinction. It's just musculoskeletal, based on anatomy, can be as short as a weekend course, and used typically for pain.
Yeah. So basically, actually, I didn't have acupuncture done. I had dry needling done.
You had, I think you had dry needling. You know what? If it worked, it worked. And as long as they were safe and, you know, I could do a whole nother podcast on regulation, but as long as they were kind of regulated in their practice, then it's fine.
Yeah. I mean, it was with a physiotherapist, but you know, for me, I am more and more getting kind of more interested in the whole holistic approach, as opposed to, I have this pain, let's fix that pain. I
Mm-hmm.
want to, why have I got that pain? What's the
Mm-hmm.
root kind of cause of that pain? And
Mm-hmm.
trying to look at it in that perspective. And it sounds like, traditional Chinese medicine looks at the whole thing rather than let's just put needles here and release whatever's going to be released. The other thing I want
Definitely.
to ask is, in my head, when I think of
Mm.
Chinese medicine, I'm also thinking of the herbs, the
Yeah.
herbal side of
Yeah.
things.
Yeah.
So is
Yeah.
that something completely different, or does that form part of the TCM?
So yeah, that does I forgot to mention that earlier. So that does fall under the TCM umbrella of treatment modalities. So herbal medicine
Right.
is very much a part of TCM, and in the UK, it's a separate course. So it's another sort of 2-year master's course. In other countries like Australia and America, acupuncture and herbal medicine are taught as a 5-year degree. So literally like a whole medical degree. But in the
Wow.
UK, it's taught as a separate master's course. For me, it was like, I'm good with the 4 degrees I have for now. I thought, let me just
Yeah.
leave that for the time being. But yeah, certainly lots of acupuncturists in the UK will go on to study herbal medicine. And again, it's very much, as long as you're under a regulatory body in the UK, it can be delivered safely. Obviously, there are considerations to be had with interactions with Western medical conditions, but the courses are taught so extensively that you are any herbalist who has been trained by an accredited course in the UK will be practicing safely. But yeah, that does fall under TCM.
Yeah, so that leads me on to the next question in terms of, TCM then. If you're going out looking for an acupuncturist or a herbal, someone that's doing herbal
Yeah,
medicine, what should you be looking out for in terms
yeah,
of qualifications and making
got you.
sure that you are being treated by the right person and they have the actual qualifications and not kind of just done a weekend course or something like that?
Exactly, yeah. So in the UK, there are 6 accredited colleges that teach acupuncture at degree level, either BSc or as a degree level diploma. And it's the British Acupuncture Accreditation Board. So they're the ones that kind of govern which colleges are kind of in play to teach those courses. So the first thing I guess you would be looking for is the nominals with either a BSc or a license set, which is LICAC. So that's what I have as a license set. The next thing you would be looking for is this person working under a regulatory body? So there are a few regulatory or kind of organisations, I should say, that exist in the UK that acupuncturists can belong to. One of the main ones in the UK that exist is the British Acupuncture Council, which I'm a part of. The key, whatever regulatory body acupuncturist belongs to, the key thing should be that there should be a PSA, a Professional Standards Authority stamp of approval on their website. And so typically an acupuncturist may have that logo on their website, or they will at least say somewhere on their website what regulatory body they're a part of. And so that's basically essentially what you're looking for. When it comes to then looking for a practitioner, so BXE, for example, the British Acupuncture Council, they have a registry. So if you type in your postcode, you can the distance that you're willing to travel, it will show you the practitioners that are have a membership with the British Acupuncture Council, and other regulatory bodies or organisations should hopefully have that. But ultimately, what you're looking for is that PSA stamp of approval with the regulatory body that they are a part of. And then I guess beyond when you've done that search on the directory body, on the directory website, you can look at their website. Ideally, acupuncturist or any practitioner should hopefully be able to give you like a free kind of discovery call, like a 15-minute discovery call before you book in with them. So when I see someone on my website who's booked in and they've not spoken to me beforehand, more often than not, I'll drop them an email before saying, do you want to chat before? Or if they've filled out their consent form, I can see what they come in with. I'll just kind of touch base with them before. I think whatever you pick, really, whatever kind of healthcare modality you're looking at, whether it's complementary, conventional, aesthetic, whatever it is, I think it's always worth speaking to the person beforehand, getting a sense of them on the phone, checking the vibe and seeing if it aligns with you as well. And what you should never feel is you should never feel sold to. as much as passionate as I am about acupuncture, I'm aware that it's not something that is fully mandatory for people. Like it's a privilege a lot of people can, if they can afford it, can opt into. And so you should never feel like it's something that is the only fix for you, or that it's kind of someone's giving you guarantees and promises, or overreaching with what they can deliver. And because, like I said, there's so many other factors that go into someone's recovery. And I'm very mindful of this, particularly for my patients who may be slightly more vulnerable, or who have chronic health conditions, or, for example, might be struggling with fertility, for example, because you're sold so many things, and they feel like it's going to make or break their progress. And actually, it's truly complementary in that regard. You know, it's not going to be the one thing that fixes everything, but as a part of a bigger picture, it can make a huge difference. But I think it's, as long as you're really clear and open and transparent with your patients about that, then ultimately that's what you're looking for in your practitioner that you end up picking. But yeah, the regulatory body with a PSA stamp of approval is probably the first step that you're looking for.
Yeah, I think there are dangers in, even patients, like say you treated me for, something, let's talk about fertility, and I had a baby as a result, and
Yeah,
there's me saying, oh, I was only able to have a baby because I had acupuncture done, and go ahead with that narrative. It's going to create a false sense of, people are just going to think, oh, wow, she had a baby because she did acupuncture, when that
yeah,
is probably not the case. It's not just that one thing,
no,
like you said.
yeah,
It helps. And that's the difference with you as well. You look at the whole picture. I'm sure you'd be advising your clients and saying, I'm going to do this acupuncture, but I also need you to do X, Y, and Z
yeah,
alongside this,
yeah,
which is the key difference, really.
yeah,
And I think that's so important. And this is where people go wrong. And then with the misinformation and the added layer of, maybe perhaps celebrities and God knows who coming out with all sorts
yeah,
of things,
yeah,
makes people have a false sense of hope as well,
yeah,
yeah, so it is very difficult. So now, kind of diving into the
yeah,
things that acupuncture can do for women's health,
yeah.
because
Hmm.
there's a whole load of, I mean, women's health is a big area. What specifically can acupuncture help with in terms of women's health then?
Yeah. So, I mean, it's such an interesting question, because in theory, acupuncture can be applied to so many different things. Because if we track back earlier to what I said about the way it views health with the roots and branches, you're not treating a
Yeah.
specific condition. You're treating the underlying signs and symptoms and the root causes of what someone is coming in with. So, in my clinic, for example, I do have a few special interests now. So I see children from 0 to 16, and then within adults, my main interests are menstrual health, fertility, and then following on from that, pregnancy and postnatal recovery, and then menopause. So essentially, from puberty to menopause, the cycles of life, those massive transitions we have as women, whether we choose to go
Yeah.
down a path of parenthood or not, those kind of hormonal shifts we have throughout our life is what that's my wheelhouse, really. And in terms of how acupuncture can support those kind of transitions and those hormonal fluctuations, it comes back to, again, that concept of balance. So if we maybe take an example, like a case example, someone who has painful periods, what we're looking at when a patient comes in with painful periods, I'm trying to figure out what is their root cause, what's going on in their diet that might be contributing to their symptoms, what's going on in their lifestyle, like are they particularly stressed at the moment, is there any kind of emotional factors going on at play. So one really unique thing about Chinese medicine is that emotions are seen as a cause of disease. Not the sole cause, but definitely a contributing factor. So a really classic example of this is grief. So if someone has experienced grief, the emotion is associated with our lungs in Chinese medicine. And what can happen is, after someone has lost someone, they go through a period of low immunity, and they're prone to catching coughs and colds. And they don't know why, but they're really susceptible to it, or they find that waking up a particular time of the night every night, and it so happens to be correlating with when our lungs in Chinese medicine are most active in terms of their energetic value. So when I'm looking at that patient, I'm really looking at their 360 view of their health and thinking about what factors are in their control, maybe not, or maybe out of their control, that are contributing to their state of disease. And then it's about finding that, again, correcting that balance. So if it's a situation like painful periods, for example, where a very common pattern associated with painful periods is something called qi stagnation. So qi means energy. It's spelled QI, and it's referred to as our life force. So we are made up of qi. We are qi. Qi is everything. And so what I want to do is to move qi, to get that qi flowing freely and smoothly. But actually, what else contributes to stuck energy in the body? So from Chinese medicine point of view, cold foods really stagnate and obstruct the flow of qi. It stagnates and kind of seizes it up. So if that person's having, and raw food as well actually does the same thing. So it kind of tires the body out and knackers the body, and you're using so much energy to get what you need from it. So someone comes and says, I'm really healthy. I have salads every single day. I'm like, great, nutritionally, but can we maybe adjust it so that actually it's a bit warmer and maybe there's a few less raw elements, and it'll give your body an easier time. What I'm really mindful of when I give dietary advice is to not give restrictive advice, because the second you do that, the more that person wants that thing. It's more about having more of the good stuff and guiding them in that. And then naturally you kind of clock intuitively as a patient, when I have this thing, I feel worse. So essentially what we do, no matter what it is, whether it's painful periods, whether it's a fertility issue or PCOS or menopause, what we fundamentally come back to is what element in that body, what kind of energetic value in that person's body is out of balance. Maybe what organs are out of balance. So organs in Chinese medicine have a very different meaning to Western medicine. They're seen in more of an abstract term in terms of their energetic value. So we may be thinking, this organ's working a bit hard, or it's not working hard enough. We need to support it a bit more. So that the applications are very wide, but when you get an accurate Chinese medicine diagnosis, i.e. you've taken a full history, you've figured out what the deficiencies are or what the excesses are in a person's body, the task then becomes relatively simple, because all you're looking to do is to rectify that balance through acupuncture, through diet, through lifestyle, through addressing mental, emotional well-being as well. So it might sound like more of a vague answer, but it's the fact, it comes down to the fact that we're really looking at just balance in the body.
Do you mind if I pick two areas that, in women's health, for me,
yes, please.
I've been, more and more, I've been speaking to women, with endometriosis, and then of course menopause, and that's me. I'm perimenopausal, right. And lots of women around me that I know are. How can it help with those two, issues really? Because let's face it, perimenopausal has, I don't know how many symptoms involved. It's like over 30 so many symptoms that can happen. And some people experience one or two, some people experience maybe 30 or 20, whatever. And then you've got endometriosis. And of course, with endometriosis, because you mentioned painful periods, and that is one of the classic signs of endometriosis, one of many as well. How would, if someone came to you with painful periods and they haven't even been diagnosed with endometriosis at this point, because again, more and more I've heard diagnosis can take, it's up to 15 years, which is crazy, How would you treat that then?
So when that person comes in to see me, so they said they've got painful periods, I take my history, I find out what their Chinese medicine diagnosis is, I choose my point prescription. But then in terms of the treatment approach, again, I'm looking at their roots and branches, but we're going to draw down in their treatment plan into the dietary aspects and the lifestyle aspects. So from a treatment perspective, yes, I'm going to be looking at relieving their pain. But fundamentally underlying that, what is it that means that what imbalances is existing in their body that means that pain is so susceptible for them? Why is it so extreme for them? Because in Chinese medicine, periods shouldn't be anything more than a mild cramp. Anything more than that is seen as abnormal in Chinese medicine. And unfortunately, in the Western kind of medical paradigm, painful periods are very much seen as normal, right? It's just part and parcel of it. And actually, if you just have painful periods, you're seen as quite fortunate, because on top of that, you can get PMS, you can get PMDD. You know, the spectrum of symptoms go far beyond physical pain. But in Chinese medicine, beyond a mild cramp, it's a no-no. We want to make sure that kind of transition every single month that a person goes through is as manageable as possible. So we, like I've said before, we dig a little deeper and think about things that they could potentially be doing at home to help in terms of either keeping warm or optimizing their diet from an energetic point of view in terms of Chinese medicine. And usually speaking, with something like endometriosis, by the time they've come to see maybe me in clinic in terms of seeking acupuncture, this has been a lifelong chronic condition. So it's not something that's going to be a quick fix. Typically speaking, for patients with maybe non-menstrual issues, I can say, look, you can maybe expect an improvement within about 6 to 8 sessions if you're regular with it and if you're doing all those things outside of treatment. With menstrual issues, typically speaking, you're working with about 3 menstrual cycles at a minimum to get a long-term benefit. And it may not be every single week they come and see you. You can kind of figure out what that patient needs on a case-by-case basis. But what the acupuncture is aiming to do is to ultimately get that free-flowing energy moving again, and more importantly, to connect the mind-body-spirit, to strengthen the mind-body-spirit connection. Because more often than not, by that point, that person is kind of frazzled, really. There's a common pattern in Chinese medicine where someone's shen, or their spirit, is not anchored. It's kind of floating up right at the top. And what we need to do is strengthen it. So again, we're looking at a deeper level beyond the physical aspects of that. When it comes to something like menopause, now this is a really interesting concept in Chinese medicine because it's actually referred to as the second spring in Chinese medicine. It's not seen as a disease or a pathological condition. And indeed, even in Western medicine, it isn't. It's a normal physiological condition. But there are, as you mentioned, there are a whole spectrum of symptoms associated with it: cognitive, physical, mental health, everything. Even random symptoms you don't even think would ever be associated with it, like feeling off balance. That's a menopausal symptom, or tinnitus, menopausal symptom. So what the aim with when someone calls me and says, I'm perimenopausal, can you help me with this? Again, what I do make sure I do highlight right at the very beginning is that acupuncture won't necessarily objectively kind of adjust your hormonal levels, like the absolute hormonal levels. There is Western evidence to say that it can influence the hormonal axis in your body, like the factors from your brain to your ovaries. There is evidence to show that it can support hormonal regulation, not balance hormones, that's a misnomer, but to assist normal hormonal regulation. There is emerging evidence from that from a Western perspective. But what I describe it as is acupuncture can help soften the edges of that hormonal fluctuation. So there's a graph I always show my patients when it comes to the perimenopause. So in the kind of regular reproductive life cycle that you have before menopause is an up and down movement, right? Up and down, up and down. It's quite cyclical, relatively speaking. When it comes to perimenopause, the hormones look like a helter-skelter roller coaster. It's like this. And I refer to it as the chaos of perimenopause. Because essentially what's happening from a Western perspective is your brain's trying to fire signals to your ovaries to produce hormones, but your ovaries by that point are kind of a bit knackered and they're not receiving the message as strongly, and they're trying to like pump out this estrogen, but it can't. And so those messages are kind of waxing and waning, ebbing and flowing, but without any rhythmic activity or kind of predictability. But eventually, when you kind of go through the perimenopause and you're into menopause, those hormones kind of level out again. But what we can do in that in-between stage with acupuncture is, whilst we might not get that rhythmic activity again, because it's physiologically that's not possible to do, what we can do is soften the effects that those fluctuations can bring up in us. And what I'm also very conscious to tell my patients is that, it doesn't have to be one or the other when it comes to medicated or non-medicated options with supporting perimenopause. So I have had a couple of patients who've come to see me. They're on their 5th or 6th session and they're feeling improvements, but they are still feeling that fundamental kind of ebb and flow and that instability with their mood. And I speak to them and say, well, have you thought about HRT before? What are your thoughts on it? And what they say is they almost feel like they're failing if they pick that option, if they pick HRT. And it absolutely isn't the case. You're not failing. There isn't a weakness to have that as an option, because you are fundamentally deficient of like life-enhancing, life-saving hormones. Like, we rely on estrogen and progesterone for so many things in our body, in our brain, our heart, our muscles. It's not just about making babies. So if that is something you feel you need, that's okay. Like, as long as you're being assessed by a GP, the risks and benefits are being weighed out, you've got a safe option for you there, and it's being monitored, you can go for it. And you can continue your acupuncture. It doesn't have to be one or the other. Having said that, if you feel like actually you can manage without HRT and you're happy to continue with something that is non-medicated, then that's okay too. I think it's just really important that patients are aware that, you know, there are options, and they can really personalize their own treatment if it's accessible to them. But it's about having that conversation really, and opening that up and making them feel safe and making that choice really.
Yeah, absolutely. Look, you know, it is a very personal choice, and every woman will go through the perimenopause very, very differently. And it's a choice you make with a qualified GP or menopause trained person. And yeah, you know, there is no right or wrong. And of course, you know, you have to decide on how it's affecting your life, if you can manage it or not. And
exactly.
Yeah, I think for some people, they have this view on taking HRT, and you know, I have my views. I'm not going to share them now because it's you know, that's not the conversation. But you know, you know, whether I take it or not, it is my business and my family's business, and it's a personal thing, you know. So yeah, and you're so right. You know, with acupuncture, it's a complementary thing. You're not going to, you know, acupuncture, nothing is going to bring those hormones back to normal, unless you take HRT, of course, because you're actually replacing those hormones. And you know, that's I'm assuming that's the case. So I think it's great, whether you are on HRT or not, to look at alternative options, because you know, in healthcare, like you say, it's not just about Western medicine. I really, you know, more and more now, I think you have to look at lots of different things. There is no one quick fix solution to lots of things. And even, you know, headaches, as an example, if you've got a headache, what do? You typically mask it with a paracetamol or an ibuprofen or any type of pain. But no one ever asks the question, hold on a minute, why am I getting these headaches? Why have I even got a headache right now? Why have I got this pain in my arm or whatever? You know, and people just want quick fixes. And
what I should
think
point
you need
out
to
is
kind
that
of expand.
What I should point out is that, you know, as anyone working in the private sector, whether you're an acupuncturist or another kind of complementary practitioners, you have the kind of luxury of time. So my first appointments are quite long, and I often overrun because my consultation is so thorough and so extensive. And never in a million years would I have that opportunity in an NHS setting. So, you know, I am in such awe and admiration of my GP colleagues, my hospital colleagues, because they are doing their absolute best in such kind of pressured circumstances. You know, 10 minutes for a person to walk in, sit down, give their history, for you to make a diagnosis, examine them if you need to, then make a management plan, explain that management plan, then execute that management plan, all within 10 minutes. Like, what? I had one GP rotation when I qualified. I could not do it. That was the one that, like, I thought I was going to go into GP before I started medicine. that within 2 weeks, I was like, only 10 minutes. And now I get like an hour and 15 with my patients in their first appointment. So, like my friends, people I'm still friends with in the NHS, I'm in just such awe of them that they're able to, even the care that they can deliver to the best of their abilities, that they're fighting the fight, And if the circumstances allowed it, and if this kind of structure and system around them changed to give them that opportunity just to spend, even if it was an extra 5 minutes, like 5-10 minutes with that patient, it would make a huge amount of difference. So I think, this is a wider, I guess, political kind of thing we were talking about, but the how we view our health in the UK and what we're putting our money into in terms of resources and preventative care, not just reactive care. I think it's one of those things where I think at some point we're going to have to look more and more at modalities like acupuncture to help us. And acupuncture is licensed for a few conditions on the NHS, so for migraines, for arthritis, lower back pain, some side effects from cancer treatment, for example, but it's quite limited. So, if you went to a GP saying you had endometriosis, they wouldn't necessarily say, "Oh, well, you go to acupuncture," because they're physically not regulated to do that. Although I could say, look, there's so many benefits. Like, I can help you with your diet, I can help you with your lifestyle, I can help you with the pain itself, I can help you with a long-term preventative approach. There's still that disparity there about what can be done in an NHS setting and what's accessible privately. But like you said, it's just a matter of time, I think, before modalities like acupuncture are going to be relied upon and leaned upon. And certainly in the UK, I think more research is kind of evolving. So one thing that's really interesting is, and I've spoken about it before on like my social media, is that in the UK with acupuncture, it has to be, in order for it to be funded and also to be kind of freely suggested within an NHS setting, it has to be replicated. The results have to be replicated within a Western evidence-based structure. So the same way that we would investigate a pill, for example, those same methodologies would be used to investigate acupuncture. But inherently speaking, you're always going to come up against a bit of a wall there, because acupuncture is really hard to investigate in such a rigid kind of structure in terms of what we call randomized control trials, because the way someone needles, the technique they're needling, how they're needling, the person that's needling, like, so much comes from the therapeutic effects that the practitioner brings into the room. They're really hard to put into a box and to categorize or to put as a binary term. So there are limitations that exist in trying to push acupuncture within a Western medical context. But I think more research the methodologies are improving and more is being done. But I think it's still worth remembering that this is a paradigm of medicine that is well over 2,000 years old, as with Ayurvedic medicine. And yes, it's based on what we refer to in Western medicine as anecdotal evidence, which is seen as a weak form of evidence, but actually, when it's stood the test of time for this amount of time, and the results have been replicable over time, then there's something in it, right? So I think
absolutely.
it's a case of merging those perspectives and having respect for both of those perspectives, like evidence-based and historical, cultural, philosophical appreciation, and merging those two, really.
I think, we were talking about GPs and consultants, doctors. They do get a lot of flack from their patients. But really, we know that they're on a time constraint. We know that there's certain processes and things that they have to follow. So, maybe we collectively, people, if they're angry with the healthcare system, they need to attack the system, not the people trying to help you, really. And it's very easy for me to moan at my GP and say, you just not listening to me, or whatever that moaning might be, or frustration might be. But maybe vent your frustration with the system, and I don't know, if we're talking about politics, go to your local MP and tell them, and say,
and in every profession, right, there are maybe some practitioners who might need a brush up on communication skills, whether it's conventional medicine or complementary medicine or whatever service industry you're looking at. There's going to be maybe a few people that you think, oh, maybe you missed that class that day. But for
Yeah.
the most part,
Yeah.
whether whatever discipline you're coming from, whether it's conventional, alternative, complementary, however we want to label it, we get into it to help people, and to try our very best with the knowledge that we have and the circumstances that we have. And so I think I think things are changing, and I mean, there was all the announcements made yesterday, wasn't there, about the NHS and a 10-year plan. We'll see where that goes. But I think for the time being, in terms of what patients can do now, in terms of really thinking about how they can optimize their own health, is, when you're coming to that GP appointment, have that list written down. Be clear about the questions you want to ask. And if you need another appointment, book that other appointment. I know for some people, they may have to wait a little bit longer for that. But what I tell my patients who come in to see me, when they've maybe said that they've had a tricky encounter, or they haven't maybe got what they needed from their GP appointment, or they're having to wait 3 weeks, we make a little plan together about what things we can talk about in that 10 minutes to wring every dropout that we can. And essentially giving that GP a helping hand to get them to help us as best as they can. But certainly I know from family members who are doctors, from friends who are doctors, and still in the game, I've bounced. I I couldn't cope, but they are still coping. They're doing their absolute best, and they're heroes, really, in my eyes.
Yeah, absolutely. So I want to just quickly address, we're talking, we talk about some physical symptoms and things, but
yes,
how can acupuncture help, and traditional Chinese medicine help things like, you talked about emotions and stuff. What about, like stress, burnout, because that affects the body. But if you haven't got any physical pain or any kind of, physical stuff going on, but, anxiety, depression, stress, these kinds of emotional things, how can it help with that? Because there's a lot of that going on as well, these days, especially with social media on the rise and all sorts of, just stress generally with pressures of working and, all sorts. How can it help with that?
Yeah, and that's so interesting, because even if someone comes in to my clinic and they've not led with anxiety or stress, as if physical health complaint, you can tell within about 5 minutes that the anxiety or stress or one of those things is a contributing factor. With kind of lifestyles that we have at the moment, where we're kind of rushing from one thing to the next. If we're having a working week, our weekends are filled with things. That element of physical rest is no longer a thing in our lifestyles anymore, right? And so fundamentally, if we maybe go back to our different perspectives of how we explain things from a Chinese medicine perspective, what we're looking at is really that mind-body-spirit connection I mentioned before is strengthening that and bringing that back into balance. When we think about the Western medical perspective, what I'm finding with a lot of patients is that they are in this kind of flight or fight mode. So in Western medicine, under neurology, we have something called our nervous system. And our nervous system is made up of two branches. So that's the sympathetic nervous system and our parasympathetic nervous system. Our sympathetic nervous system is what we refer to as that fight or flight mode. So, in caveman times, when we had a tiger coming to us, our sympathetic nervous system would kick in and we go in survival mode. So all the non-essential functions in our body would shut down, and we reserve all our energy to fight off that danger. When it comes to our parasympathetic nervous system, it's about rest and digest. So we're able to ease up, we're able to do the slower processes in our body that keep things ticking along. But what's happened now in our modern day and age is that we are constantly in that flight or flight mode. And although that tiger's no longer there, the danger we're sensing is still there. Whether it's something that pops up on our screen, a notification that's popping up on our screen, a video that lasts for about 3 seconds and another one comes up, or the next meeting or deadline that we've got. Those are the kind of subliminal dangers that our minds and our bodies are picking up on. And so we're kind of low key in this state of flight or flight mode pretty much all the time, and it may wax or wane, but it's kind of at a baseline there. And so what acupuncture is great at doing, and one of the, I guess, the bulk of evidence really that lies behind acupuncture, one of its benefits, is about regulating our nervous system. And there's evidence to show it can have effects on lowering your heart rate, on increasing oxygen availability. So on a fundamental level, on a biochemical level, it really helps to kind of quieten those signals down, and allowing our body to then pick up on those quote unquote non-essential functions that may have been shut down. For example, our hormonal axis, our reproductive axis. So when someone's coming in with something that is a reproductive issue, or a menstrual issue, whether it's premenopause or postmenopause, actually, if we go and kind of use the approach of figuring out what's going on with their nervous system first and their mental health, more often than not, you're going to have a direct benefit on whatever physical health complaint they may have too. So again, it's going back to that concept of what is the root cause of what's going on. You know, in terms of other kind of mental health issues like depression, for example, obviously that's a very multifactorial thing as well. And sometimes it is circumstantial, sometimes it's a case of time and giving that person permission to feel what they're feeling and to support them through that. Because again, in this day and age, we're quick to suppress things quite a lot, right? And we want to just get on with our day, keep going, keep moving forward, and we don't necessarily give ourselves, or we don't have the time to give ourselves to feel what we're feeling. And actually sometimes giving a patient just explicit permission to do that is a huge part of the healing process. But certainly from a Chinese medicine perspective, say we're dealing with grief, for example, what I'd be looking at is what points would be good at supporting the lungs, because the lungs are the emotion most associated with grief.
Yeah.
If it's stress or anger or frustration they're dealing with, then the organ associated with that is the liver. So what points can I use to support the liver? Worrying and overthinking associated with the spleen in Chinese medicine. Sounds a bit random, but it makes sense in Chinese medicine theory. So I'll be supporting the spleen. The heart, to do with joy and sadness. So, you know, that no matter what a person comes in with, I can hone in on what they're telling me, what I'm picking up from them in the subtext of what they're saying, and then figuring out, okay, what is it in their body that I can think to address in terms of their point prescription? How can I tailor it to them?
What about trauma? Someone's gone through trauma, whether that's, you know, childhood or in adulthood, or very recent trauma. Can that, you know, can you help with that?
Yeah, so I mean, first and foremost, talking therapy definitely has its place in that regard. No matter what a patient comes in with, to be honest, like, I mean, a huge part of my treatment involves the consultation and chatting through things and talking through stuff that's in itself has a very therapeutic effect. It's moving stuckness in the body and verbalizing it out. So that's a really important part of my consultation. But if I feel they need a bit more structure, a bit more deeper work around it, then I'll refer them to a talking therapist, depending on what modality they need. So that should be definitely highlighted as another kind of supporting principle. But interestingly, with trauma, you know, when I spoke right at the beginning, when I said, you know, two people come in with the same things, but what makes them is a thing that differs, and it means that their Chinese medicine diagnosis is different. Childhood and experiences, including trauma or adult trauma, all feeds into that. And there's a common saying that you've maybe come across, our body keeps a score. I think there's a book that's of the same title. And that is just so true, Shreya. Like, our body absorbs everything. And even if you feel like you maybe have dealt with something at the time, if it hasn't been processed kind of as much as you can, then your body will hold on to it. And, you know, naturally there are some things that will be a lifelong thing to process. It's not necessarily things, trauma in particular, it's not a one and done situation. Depending on the level of trauma there is, that will always be a part of someone's lived experience. But moving forward from that, what acupuncture can do is help that person on a really deep philosophical level, unite those fractured pieces that may be existing within them on an energetic level. And I know that sounds a bit woo-woo and a bit soft, but that's kind of the beauty of it, is that it's that intangible aspect of someone's healing that we're really tapping into. Yeah.
No, thank you so much. I mean, Sunila, it's been fantastic speaking to you. Honestly, we've covered so much, and I wanted to cover all these different aspects because I
Yeah.
feel like, you know, for me, I didn't know about what acupuncture can actually do. And then, of course, you know, the dry needling and then the actual acupuncture and the TCM, because it's not just about physical pain. You know, that's why I wanted to talk about stress and
Yeah.
trauma and a few other
Yeah.
bits, because some people might not think about acupuncture in that way. So
Yeah.
that's why I was asking you all these questions. But
No,
thank
I'm
you
so.
so much. It's, you know, I think you're amazing, and
Oh, thank you,
like
Shreya.
honestly, it's great to have someone unique as you that knows both sides, the Western and the Eastern, and is fully trained in both. You know, it's
Yeah.
very unique. So thank you so much for being on the podcast.
Oh
It's been
no.
great to have you on.
Thank you so much for having me. You know, I was really grateful for the opportunity because, like you said, I guess I am in a unique position where I've got experiences from both angles. And what I want is for both patients and other medical professionals to just have a bit more of awareness and understanding around Chinese medicine as a whole, including acupuncture, having that openness and the discussion. Sorry, my answer may have been a bit long-winded sometimes and not always necessarily very straightforward, but that's because Chinese medicine itself is not a straightforward paradigm of medicine. There's many layers to it.
Yeah.
The more you practice it, the more simple it does become because you realize you can hone in on your skills, but it's such a layered nuanced paradigm of medicine, as other ancient paradigms of medicine are, like Ayurveda. And I think, like we said, you know, there's a place for everything. There's a time and place for everything. And I'm just really grateful that you're open to having someone a bit woo-woo like me on that's done a bit of both.
Yeah, look,
to speak about it more.
I don't think it's woo-woo. I think
I don't
people,
think it is either, but
yeah,
you
I
know,
mean,
that people have their perceptions and
oh
things.
yeah,
That
they
it's
do.
just about accessibility and translating it into language, I guess, that
Yeah.
people can
And
get
look,
and
people are
understand.
looking for alternative solutions to their problems, you know, when Western medicine isn't working. And, you know, don't get me wrong, obviously Western medicine of course has its place because you
Yeah,
need certain medicine to treat certain diseases, and of course the emergency situations.
yeah,
You can't, you know, call in an acupuncturist while you're having a heart attack as an example, right? You
yeah,
know, so
yeah.
you know, there's a place for all of that. But
Uh-huh.
when you complement Western and
Yeah,
Eastern, other you know forms, I think it can be amazing for your body. Really,
yeah,
that's
yeah,
my view anyway. But yeah, thank you so much
yeah.
for sharing
Yeah,
all
and
the
just quickly,
information.
I thought I'd say is just to make sure we highlight that we should be all really grateful to the people who have originated this practice too. So whether it's Ayurvedic medicine in India, the Chinese medicine practitioners who originated from China as well,
Yeah,
they've not gatekeeped this medicine. They've been so open and sharing this paradigm of medicine, and it's travelled across the world. So very much appreciative of the origins of the practice too.
oh yeah, absolutely,
Yeah,
absolutely. Because you know, I think that's really important to.
yeah,
And that's a whole different conversation because I love history and
yeah.
I like to know about the history of stuff.
Yeah,
But
yeah,
that is a different conversation
yeah. Do
completely.
another
Yeah,
session.
that would be a completely different conversation. But yeah, I think absolutely it's
Yeah,
always important to acknowledge and be grateful for you know these historical amazing people that found these
yeah,
different ways of doing things. They're not
yeah.
even different. That actually it wasn't even different to us. It's
No,
different,
it's the
but
norm.
that was their
Yeah,
way of treating people,
yeah,
right?
yeah,
Yeah.
yeah.
But yeah, thank you
Thank you
so
so
much.
much, Raya. Thank you.
Thank you.